Hi, welcome back to RNPNTUTOR USA. Today we're going to talk about some psych medications. Let's first start to talk about the anti-anxiety medications. Most of the medications we're going to talk about in this section are the benzodiazepines. These drugs are used to treat anxiety as well as they can be used as sedatives or tranquilizers. This is because we know that these drugs increase the release of GABA at the synapse. How do we remember these drugs? Remember that, first of all, if you think about the structure, benzodiazepines have a benzene ring or benzene rings in the structure, as well as if we have to remember them, we remember that the ending of the drugs end in am or pam. So if you need examples of this, think about drugs like alprazolam or lorazepam, diazepam, or even clonazepam. So all of these drugs end in am or pam. Now, things for the nurse to remember about giving these drugs or administration of these drugs, all of these medications have the tendency to cause impaired judgment. They cause drowsiness and dizziness, poor concentration. Do remember that clonazepam is a little bit different because it causes alertness in most patients. Now, be concerned that it's also a normal finding, or be aware rather, that you can have decreased blood pressure if the patient is on an anti-anxiety drug. Now, we do have the anti-anxiety drug that does not end in PAM, that is still a benzo, is chlordiazepoxide. And we also refer to this drug as Librium. So remember again that these drugs cause impaired judgment and drowsiness. Whenever patients are started on benzodiazepines, they generally get medical clearance. For example, the medications will be ordered, but they'll have medical clearance like cardiac clearance, renal, or even pulmonary clearance prior to starting these drugs, hepatic clearance. Now, benzos are started with a low starting dose, and they do have the risk for addiction potential, not as much as some drugs, but they do have the risk of addiction. Many young people currently are addicted to Xanax, otherwise known as alprazolam. You always remember that there has to be a gradual reduction in dosing if the patient is to stop. And so generally, they should not abruptly just stop taking the benzos because of withdrawal effects. And then they shouldn't be mixed with alcohol because alcohol tends to intensify or potentiate the effects of the benzos. Now, we're going to move into talking about the tricyclic antidepressants. Remember that the tricyclic antidepressants treat depression. Like we said, they're tricyclic. Let's talk about these drugs. These drugs include drugs like imipramine, desipramine, amitriptyline, or nortriptyline. How these drugs work, they regulate the brain's reaction to serotonin. In doing this, for example, if they're used to treat someone with OCD, they'll reduce the number of obsessions. So remember that with OCD, the patient has both obsessions and compulsions. But these drugs are generally considered antidepressants. Now, we know that with antidepressant drugs, there's a lag period before the patients will start to see a lot of reduction in their symptoms. So, for example, for the first week, maybe they'll have very minimal reduction in symptoms, but up to the third week, most of these drugs start to work. Treatment tends to be for a long period, generally 6 to 12 months, or for some patients, it's for a lifetime. Usually, again, these drugs are started with a gradual dose, and then they'll increase, like a low starting dose, and they'll try to increase them from that. Again, we want to monitor liver function whenever patients are on these meds. They do have the undesirable effect of causing weight gain. And of course, if patients are over 40, they require cardiac clearance before they can use these drugs. Remember that tricyclics are highly toxic in excessive amounts, and we have to be very cautious with suicidal clients. If the client is very suicidal, we could work with the physician to modify to see whether or not we should advise them to give their entire or take their entire week supply. Some of the side effects of the tricyclic antidepressants, if you look at our pictures, think about the anticholinergic effects of these meds. And so they cause dry mouth, constipation, blurred vision, difficulty voiding, in some patients, urinary retention, anxiety, even increased restlessness, and they can increase the risk for seizures. These, again, have the undesirable rather, effect of causing weight gain. Again, they're contraindicated in patients who are pregnant, of course, or if there's any prostate issues, alcoholism, or glaucoma. Again, because of the anticholinergic effects. Talking about drugs like amitriptyline, imipramine, these are the tricyclic antidepressants. Next, we'll discuss the SSRIs, or selective serotonin reuptake inhibitors. These are other drugs that are used to treat depression. These drugs end in the letters I and E or an ene. So think of drugs like fluoxetine, sertraline, or paroxetine. Like other antidepressants, these drugs do not start working the same day. So if the patient is depressed on Monday and they start taking these drugs on Monday evening, they probably will be depressed Monday and Tuesday and Wednesday, because these meds need time to start working. They have to build up a therapeutic level, and it takes time. So there is usually, if they're going to add any other drugs or try any other medications with these patients, there has to be a washout period. Generally, from anywhere from 2 to 5 weeks, the patient has to stop using the SSRI before they can start other meds. Remember also that SSRIs have certain side effects. They're known to cause insomnia. In some males or many males, they'll increase sexual dysfunction. In some females, but it's mostly reported in the males, they have lesser side effects than the TCAs, and they don't cause as much weight gain, but they are known to increase suicidal ideation in younger individuals. Now, the SSRIs can cause a rare but potentially fatal condition called serotonin syndrome. And usually this is related to overstimulation of the serotonin receptors. So why would a patient have serotonin syndrome? It's either that the dose is too much, or they've added other drugs with the SSRI and now they're having drug interactions. So how will you know that the patient might be going into serotonin syndrome? Think about things like having an elevated blood pressure. They'll also have diarrhea in the beginning, abdominal pain. Some patients start to have delirium as it gets later. As the symptoms get severe, patients have very, very high fevers and go into shock. We can use beta blockers like propranolol to block serotonin receptors, and of course symptomatic management. So we could do things like placing a cooling blanket on the client, hydration, management of someone who is getting very hot. So other side effects, again, of the SSRIs, they cause diarrhea, migraines, they have less weight gain than some of the other antidepressants, but they also have the potential to cause a very rare but potentially fatal condition called serotonin syndrome.